So posterior abdominal wall, you can see in the midline it is being contributed by the different lumbar vertebra, and in the pelvis you can see this is the sacrum. So on either side we can get skin, superficial fascia, deep, okay. Then we can get the muscles, okay. So which will form the lateral part of the posterior abdominal wall. And here we can see the muscle that is on either side of the lumbar vertebra. We can see 1, 2, 3 muscles. Medially we can get this muscle with along with another muscle which is taking origin from the right and left iliac fossa. We know that is the iliacus. As a whole, we treat it as a twin muscle, Iliopsoas group of muscle. So here we can get on the midline the iliacus muscle, and in the pelvis we can get the psoas major muscle, and this is the iliacus. So we know the insertion point, that is the lesser trochanter. Already we know that there is a lesser trochanter in the femur, where we can get the insertion. So origin of this muscle is from all the anterior aspect and above and below the vertebral bodies of L1 to L4, L5 vertebra. And also one slip we can get from the T12 vertebra. So as a whole, on the medial we can get this an arch area which is called the psoas arch. And this muscle is covered with one sheath which is called the psoas sheath. Also this iliacus muscle has got one sheath, that is the sheath that is covering the iliacus. So as a whole, that is called Iliopsoas sheath. And most interestingly, this psoas sheath, if you trace it above, we can get the lower limit of the diaphragm, and here we can get a thickened margin that is called medial arcuate ligament. There are some ligaments from where this muscular, we know this is the diaphragm which separates the thorax and the abdomen, and it has got some origin, and one of the important origin is these classes, okay, and also the ligaments. One is ligament at the medial side, at the midline, that is the median arcuate ligament. This one is medial and this one is lateral. What I want to impress on your mind, that is the psoas sheath. The sheath which covers this muscle is thickened above and forms this medial arcuate ligament, and through which we can communicate with the thorax, more precisely the posterior mediastinum of the thorax. And we can get an area just below this medial arcuate ligament. We can get the emergence of sympathetic trunk and right or left, or right side right, left side left, sympathetic trunk. Along with we can get least splanchnic nerve. So lateral to the psoas we can get one muscle, that is the Quadratus lumborum, which takes origin from the iliac crest, and it is also destined above it, and it is inserted to the 12th rib. Okay. So these muscles are mainly for when a person is lying down, he is trying to bend his body. So from lying position to recumbent position, they help in flexion of the vertebral column. And there are other actions. Suppose psoas major of one side contracts, then we can get separate action. Psoas major of two side when acts, we can get the forward bending of the vertebra. So similarly, we can get this muscle, that is the quadratus lumborum, and this quadratus lumborum is again covered with one sheath. Sheath is called anterior layer of the thoracolumbar fascia. From thorax to lumbar region, that fascia is continuous. So that name of this fascia is called thoracolumbar fascia, and that anterior layer covers this muscle. There are three layers: anterior layer, middle layer and posterior layer. Gradually we will understand, but just now you can just try to remember this is anterior layer of the thoracolumbar fascia. So psoas fascia, thoracolumbar fascia, why these are there? Because when these muscles will contract, there are some viscera in front, they are not been affected, separates the muscle from the overlying viscera, or the viscera which are present on the in the anatomical position, they are in front, ventrally placed viscera. So when these muscles are contracting, there is no change within the abdominal cavity and no change in the position of the abdominal viscera. Okay. And more laterally, we are getting one muscle that is called the Transversus abdominis. Okay. So this area is the origin of the Transversus abdominis, and also we can get the origin of the Transversus abdominis. Okay, from the iliac crest we can attach, we can see the attachment of the Transversus abdominis. Okay, so we can get three muscles. This is the psoas, this is quadratus lumborum, and this is the Transversus abdominis. That much you try to remember. And you can find this lateral arcuate ligament, which is nothing but the thickening of this fascia which is covering the quadratus lumborum muscle, which becomes thickened here and it forms the lateral arcuate ligament. So the anterior layer of the thoracolumbar fascia gets thickened to form the lateral arcuate ligament. So this is, here you can see nicely the three muscles, and also we can see the medial and lateral arcuate ligament. This is the median. This is medial and this is the lateral arcuate ligaments. So median arcuate ligament is nothing but we can get at the level of T12, lower part of the T12 vertebra, which is being formed by two crura. There are the diaphragm has got two crura, right, like cross-like structure, that is called crura. The right crura, and this is the right crura, and this is the left crura. Right crura is continued up to the L3 vertebra. Left crura is continued up to L2 vertebra, and the connection between these two forms a ligament which is called median arcuate ligament, below which we can get one opening through which we can get the aorta, and also sometimes we can get the azygos vein. So this is another opening. Okay, we can see this is the another opening. So this is another opening through which we can enter into the posterior mediastinum of the thorax. Communication between the abdomen and the thorax. So this is the origin of the psoas major muscle. From above and below, we can see the vertebra, okay, and in between the vertebra we are getting the intervertebral disc. So it is taking origin from the above and below of each lumbar vertebra, and also from the intervertebral disc, and also from the anterior part of the body of the lumbar vertebra, and also the upper origin may extend up to T12 level, T12 vertebra. So it is taking origin and it is coming down, and ultimately it is inserted into the lesser trochanter. Here you can see this muscle. It is being supplied by the lumbar nerve, the ventral rami of the lumbar nerves, L1 to L3 or L4 lumbar nerves. Now, this is a very important figure. Here you can see the different nerves of the posterior abdominal wall, which we have to identify. Okay. Now we know this is the lateral arcuate ligament, and below which we can get some structure from above below. Only here we can see the subcostal nerve or 12th thoracic nerve. Not only the nerve, also vein, artery, nerve. They are coming down from above below through this opening, that is the opening at the lateral arcuate ligament. So here we can see the subcostal nerve, that is the 12th thoracic nerve. And also we can see these two nerves are coming down just below the subcostal nerve. The above one is the iliohypogastric and the below one is the, look there, that is ilioinguinal nerve. Actually, this two nerve has got same root value, that is the L1. Actually, we are concerned with spinal nerve is coming out. It divides into ventral and dorsal rami. Just forget about the dorsal rami. We are concerned with the ventral rami. Spinal nerve is coming out. It divides into ventral and dorsal. Forget the dorsal rami. We are not concerned with the dorsal rami. The ventral rami of L1. Actually, it is continued as iliohypogastric nerve, and from where one collateral nerve is coming out, that is nothing but the ilioinguinal nerve. Iliohypogastric nerve and ilioinguinal nerve you may have seen in the anterior abdominal wall, in the inguinal region. You have seen that ilioinguinal nerve, it does not pass through the, you can remember, deep ring. It does not pass through the deep ring. It goes parallel to the medial part of the spermatic cord, and ultimately it enters through the superficial ring, and ultimately it supplies the inguinal and the also the genital region. So that is the ilioinguinal nerve. So iliohypogastric, ilioinguinal. Basically root value is L1. Okay. The next nerve we can see, that is the lateral femoral cutaneous nerve. We have seen in the lower extremity lateral femoral. There are lateral femoral, intermediate femoral and medial femoral nerves, cutaneous nerves. So that is the lateral femoral cutaneous nerve. And that is the root value is L2 and L3. And more precisely, the dorsal branches of ventral rami of L2 and L1 nerve, L3 nerve. What is the meaning? Dorsal branches of ventral rami, that means spinal nerve is coming out, divides into ventral and dorsal. I told you, forget about the dorsal rami. This ventral rami again divides into ventral segment and dorsal segment. This ventral rami is again dividing into ventral segment and dorsal segment. So dorsal segment of L2 and the dorsal segment of ventral rami of L2 and L3 joins to form this nerve. So this is the lateral femoral cutaneous nerve, which we can see it resides over the iliacus muscle. See there, iliacus muscle, and it passes just below the inguinal ligament near the anterior superior iliac spine, and it supplies the lateral part of the thigh, and that nerve, when affected sometimes, that is called, there is a peculiar sensation, feeling. Okay, so that is called meralgia paresthetica. When this nerve is affected, in many diseases it is affected. Okay, suppose in peripheral neuropathy, it may get affected. It may get affected in hypothyroid. Okay, state. So that is the peculiar sensation. Okay, is felt, numbness, sometimes paresthesia, excess pain, excess feeling. Okay, sensation, that is a paresthesia. So that is called the meralgia paresthetica. The next nerve you can see, it is peeping in between these two muscles, that is the psoas major muscle and this is the iliacus muscle. This muscle and one nerve is peeping in between, that is nothing but the femoral nerve. It is the dorsal segments of ventral rami of L2, L3 and L4. Dorsal segments of ventral rami has got dorsal and ventral. Dorsal segments of ventral rami of L2, L3 and L4. L2, L3, L4 joins to form this nerve, and it comes out through the lateral margin of the psoas major. You can see all these nerves, that is iliohypogastric, ilioinguinal, lateral femoral, even the femoral. We have to search that those nerves at the lateral border of the psoas major. So we can see that nerve, and that nerve is in between psoas major and iliacus muscle. We have seen the femoral nerve in femoral triangle, that very nerve is coming out from there. Okay, one thing you have to remember, actually these nerves are coming from lumbar plexus. Like brachial plexus, in the lumbar region is lumbar plexus, and this lumbar plexus is contributed by the ventral rami of L1, L2, L3 and part of the L4. Part of the L4, that everywhere the fourth nerve bifurcates. In cervical region, fourth nerve bifurcates. Okay, in everywhere. So this, here we are getting the L4, part of the ascending branch of the L4, and L1, L2, L3 and ascending part of the L4 joins to form a plexus, where we can say get it within the mass of the muscle mass of the psoas major, and ultimately they are coming either from the lateral side, from the ventral side or from the medial side. All these nerves are coming, and on ventral part of the psoas major, one nerve is coming out and it is lying over the psoas major muscle, that is nothing but the genitofemoral nerve. Root value is L1, L2. So ventral branch of L1 and L2 joins to form this nerve. Okay, so it will reside over the psoas major muscle, genitofemoral. That means it supplies the genital region and also the femoral region. Genitofemoral L1, L2, but preferably it should be called as femorogenital because L1 is femoral and L2 is genital. So that will supply the genital region, the scrotal area, mons pubis and labia major on the medial side of the thigh and premasteric muscles. Okay, so in a newborn baby, if we strike the medial aspect of the thigh, there will be, we can appreciate one reflex that is called cremasteric reflex. The testis will come up. That is the ball valve mechanism which will close the superficial ring. Well, there are some mechanism by which the hernia is prevented. So that testis will come up and the cremasteric muscle will contract, and that is due to this nerve, the genitofemoral nerve. And most medially we can see one nerve which is called the obturator nerve. We can see the obturator nerve. The root value is ventral branches of ventral rami of L2, L3 and L4. Okay, L4. Then we can see another nerve which is coming out. Medial to the obturator nerve, that is called Lumbosacral Triangle. I told you that fourth lumbar nerve divides into ascending branch and descending branch. That descending branch along with L5 nerve comes down and they are called the Lumbosacral Triangle. So the root value is, this root value is L4 and L5. This lumbosacral trunk with coccygeal nerve, we can get the sacral plexus. So this is the insertion point of the psoas major at the tip of the lesser trochanter, and the base we can get the iliacus muscle. So here we can see the origin and insertion of the quadratus lumbar. Quadratus means quadrangular shaped muscle. You can see, and it is taking origin from the iliac crest, the ventral segment. From the ventral segment has anterior 2/3 and posterior 1/3. From the posterior 1/3 we can see, and it forms a ligament, and we can get the origin is, we can find a ligament like. Okay, we will know about that ligament later on. Okay, lumbosacral ligaments are there, you will know. But you can see this muscle is taking origin and it is inserted over the 12th thoracic vertebra. So when this muscle will act from below, the 12th will get fixed. When this fixation is necessary? During respiratory movement. Okay, during respiration, we know the diaphragm will, either it will come down, and during expiration it will come up. So during respiration it has to come down. Okay, so 12th rib has to be very much fixed. So fixation is held by this quadratus lumborum muscle. So this is also a muscle, accessory muscle of respiration. Okay, quadratus lumborum muscle. So when it contracts, quadratus lumborum of one side contracts, there will be lateral bending of the vertebra of one side. Similarly, lateral bending of the vertebra on other side. When they will contract both sides, there will be dorsiflexion of the vertebra. You will know that is gradually you will know everything about the quadratus lumborum. So in dissection class, we have to identify this muscle first. So here we can see this is the vertebra, this is the vertebral spine, this is the we can see the transverse process, and here we can see one fascia which is continued from the lumbar region to thoracic region. So that is called thoracolumbar fascia, and it divides into three layers. You can see this is the anterior layer, this is the middle layer, this is the posterior layer. So anterior layer, you can see this covers the quadratus. This is the quadratus lumborum muscle. This is the psoas major muscle. Psoas major muscle in front has got the psoas fascia, and this anterior layer of the thoracolumbar fascia covers the anterior part of the quadratus lumborum muscle, whereas the middle layer covers the posterior part of the thoracolumbar fascia, and ultimately it is attached to the tip of the transverse process. Okay, and the posterior layer of the lumbar fascia goes back, and ultimately it is attached to the spine of the lumbar vertebra. So this is thoracolumbar fascia. It has got anterior layer, middle layer, and the posterior layer of the thoracolumbar fascia. In between middle layer and the posterior layer, we can get erector spiny group of muscle, which cause erection of the spines. Okay, when that muscle group will contract, so that is called erector group of muscle. Okay, erector spiny group of muscle. So these are three fascia, the layers of the thoracolumbar fascia. It is continued within the thorax. Okay, from where we can get the origin of also that we can get the origin of the latissimus dorsi and trapezius, and then it is continued in the neck as the deep cervical fascia. That's thoracolumbar fascia is not only continued in the thorax, and ultimately it will be continued as the deep cervical fascia in the neck. Okay. So this is one of the clinical aspect of the thoracolumbar fascia, which is, we know there is cold abscess in the TB spine. TB is tubercular infection, the tubercular affection of the vertebral body in the thoracic, the lower thoracic and upper lumbar region. The pus may trickle down to the psoas fascia. Even it can reach in the posterior mediastinum. It can come down within the lower extremity. It can come down on following the different pelvic viscera and pelvic muscle, or even with the nerves, it can trickle down, and we can get several abscesses within the pelvis, like iliopsoas abscess, the abscess within the rectum, pararectal abscess. We can get, even it can come down through a weak point in the pelvis. That you will know gradually. There is a solvis line, there is a weak point through which it can enter into the gluteal region also. Okay, so that is a Psoas abscess. Now we can see the psoas major muscle laterally. Medially we can see the fifth lumbar vertebra. Then we can see the sacrum. This is the fourth, this is fifth lumbar vertebra. This is the sacrum. So medially we can get this fifth lumbar vertebra. Laterally we can get the medial border of the psoas major muscle, and this is the ala of the sacrum. Here we can get one triangle. This triangle is called lumbosacral. It is from lumbar region to sacral region. So this is the lumbosacral triangle of Marcille, where we can get some structures. We can see some blood vessels and nerves. They are called oils from lateral to medial. Oil means, O means obturator nerve, I means Iliolumbar artery, L lumbosacral trunk, and most medially is the sympathetic chain or sympathetic trunk. So O, I, L, S. So that is the oil structure. So when we can get, we have to retract the medial border of the psoas major muscle. We can see the oil structure. That means obturator nerve, ilioinguinal. That is that one vessel we can see. That is the Iliolumbar artery. And then is the lumbosacral trunk, and most medially that is the sympathetic trunk. Obturator nerve, then Iliolumbar artery, then lumbosacral trunk, and most medially sympathetic chain or sympathetic trunk. So this is the lumbar plexus. You can see it's mainly contributed by L1, L2, L3 and part of the L4. And part of the L4 is coming down and ultimately it joins to form the lumbosacral trunk. Okay, contribution may come from the 12th the subcostal nerve or 12th thoracic nerve. Also it can come like in our brachial plexus. Okay. 5, 6, 7, 8, T1 contribution may come from the L4, C4 also. So that is prefixed. The contribution is more from the T12, that is prefixed, and contribution is more, if the contribution is more from the L5, that is called postfixed. Okay. So we can see iliohypogastric, ilioinguinal, we can see the genitofemoral L1, L2 and the dorsal branches of ventral rami of L2 and L3. This is the lateral femoral, and dorsal branches of L2, L3 and L4 femoral nerve, and ventral branches of L2, L3 and L4 obturator nerve, and this is the lumbosacral trunk. That is the lumbar plexus. The lumbar sympathetic chain, you just have an idea. We have seen the three arteries, celiac trunk, superior mesenteric artery, inferior mesenteric artery. So we can get the celiac, so the nerve plexus around the celiac trunk, celiac plexus. Then we can get the aorticorenal plexus or superior mesenteric plexus, inferior mesenteric plexus, aorticorenal, renal, okay, or inferior mesenteric plexus, and then we can get the hypogastric plexus. Okay, we can get at the L5 or S1 region, that is a presacral nerve. Actually, that is also called misnomer. That is, sometimes it may present in the L5 vertebra. So that is, though it is called hypogastric plexus or the presacral plexus. Because these nerve plexus are important, it has got some clinical value. In spasmodic dysmenorrhea, dysmenorrhea means painful menstruation. So we have to, there is a role, definitely there is a role of the sympathetic nerves. So if we can destroy this nerve, then there will be relaxation of the muscles. Okay, so that is called presacral neuvectomy. Presacral neurectomy. You have to find in the posterior abdominal wall, we can get the aorta, we can get the inferior vena cava, we can get the lateral branches like renal artery, we can get the other arteries like arteries or the vessels like gonadal vessels. You know the gonadal vessel is coming, that artery is coming from the aorta. Okay, the lateral branch. Okay, other gonadal vessels means that the vein on the right side it drains into the inferior vena cava, on the left side it drains into the left renal vein. So you can get these vessels, and also we can find the kidney. Okay, and behind the kidney we can get all these iliohypogastric, ilioinguinal, lateral femoral, cutaneous nerves. Okay, so we can get these structures within the posterior abdominal wall.